Good morning, everyone, and welcome to our keynote session. I hope you're all aware this is the session, first session of the first day of a 4-day conference, which I think sets the scene and context for the days that follow. And indeed, there's some direct relation to the events that we've got on this afternoon, which I'll touch a bit more on at the end, if that's okay. So my name's Sean Danielli. I'm a trustee at London Sport. Great honour to be in that position. I've only been in that position for the last 3 or 4 months. My day job, if you like, is I'm the Director of Population Health and Inequalities at King's Health Partners and NHS South East London. So inequalities is something that runs deep into my heart and my day job in terms of addressing it. We've got some fantastic speakers this morning, so I'm going to keep my introduction remarks to a minimum to give them as much time as possible, but I'll potentially offer a few reflections at the end. In terms of the format of the session, we're going to run the presentations back to back and then take Q&As at the end. So each presentation will be around 15 minutes and then we shall allow 20-25 minutes for Q&A at the end. So could I please ask that you post any questions on the platform, which we'll collate together and try to group thematically, and then we can put to all panelists at the end. So there should be a small icon on the left-hand side of your screen that allows you to post questions. Okay, so without further ado then, I'll introduce our first speaker. So huge thanks to Tim Hollingsworth. So Tim is the Chief Exec of Sport England since 2018. Prior to that, Tim was Chief Exec of British Paralympic Association, in which he led that organisation into 4 Paralympic Games, including the best ever Winter Games performance in South Korea in 2018, Rio 2016, where they finished second. And that was off the back of an incredible, which I'm sure most of us can all remember, London 2012. So huge grateful for Tim joining us this morning. So over to you, Tim.
Thank you very much, Sean, and thank you very much for that introduction. And good morning, everyone. It's incredible to look back on those times. It does feel in so many ways a different world. And before I go any further, I suppose I should say to everyone, welcome to my my spare room. This is one of the strange things about Zoom at the moment and the various other ways that we're connecting with each other, but it works for me. My opportunity in kicking off this conference, I'm delighted and indeed honoured to be asked to be the first speaker, but alongside my colleagues on the platform today, my hope is to do the job that I want to do, which is to try and set something of a scene from a Sport England perspective, but also because of the range and the responsibilities that we have as an organisation, some of the wider information and awareness I have of the situation that many of you will be facing and many of you will be certainly looking to tackle. And I know across the week of Active London that you colleagues in London Sport and beyond will be looking to focus on as well. Just all I wanted to do really at the start is realise that we're here at about 9:30 on a Monday, where there's been a huge amount of focus once again on where we all are as a nation over the weekend. I'm just going to say, actually, and I try to interrupt my flow, but to Sean, whoever, I've got an awful lot of noise in the background, which is not sure whether that's intended or not, but it's making it quite difficult to hear myself. I don't know whether it's true for everyone else. Anyway, we'll crack on. But I think, you know, looking at the weekend's news and seeing it through the lens of activity, what it does do absolutely is further establish in our mind just how fragile the situation is at the moment, how volatile the situation is at the moment, and how necessary it is therefore for us all collectively to recognise and understand the fact that if we are going to, in our view, and I'm sure we all hold the view, absolutely maximise the opportunity that individuals across the country and specifically in London and the South East should have in terms of being active, in being able to feel the benefit of that for their physical and mental well-being, the way that that can help support and maintain communities, then I do think we absolutely have to be very cognizant of the challenge that we face. And that's not just in relation to the emerging situation around the fight against the COVID pandemic, and particularly the emergence today of further guidance and information around restrictions and lockdown that will happen either regionally or locally, clearly coming very much to the fore. Although you only had to listen to the radio this morning to understand how real that is, and for example, how that might have a direct impact on gyms, pools, sports centres, and on the areas where many people, particularly those in local authority areas, where those are publicly run facilities who rely on those facilities for their activity levels. But if you look at a couple of other things for me this morning, I just caught briefly a radio interview with John Amici talking, and many of you will know who John is, first Briton to go and play in the NBA, but now a renowned psychologist and an amazing guy. But John still was talking very frankly on the radio this morning about how when he leaves his flat in central London, people still consider him basically to be a threat. And that sort of endemic racism that still exists across society that has its impact on sport and has its impact on physical activity. And I think that's a big part. Even before the Black Lives Matter campaign brought its profile much higher, it's a big part of the area of the work that we're looking at now today and across this conference that we should not forget. And lastly, also another thing I saw this morning, which brings it home to me on Twitter. I have a colleague, Chris Whitaker, who with his wife Fran both have cerebral palsy, both have since March been shielding because of their concern about their health and their well-being. Chris is now in pretty much the 7th month of that for him and his wife, and the strain and the challenge and the nature of that being an absolutely typical example of how people, disabled people, and those living with long-term health conditions face a further barrier to finding ways to be active and finding ways to support themselves physically that many of us otherwise would take for granted. So we have some real challenges just beyond the immediate to think about and tackle. And I hope that my introductory remarks this morning can help support some of that debate. At the same time, I think there's a lot to think about and welcome and celebrate in how we've come together as a sector to think about the solutions and problems that we're seeking to address. And I think even at the beginning and the outset of this pandemic, an understanding of the benefits that physical activity can have to people's lives, and the fact that in the first stages of lockdown, one of the 4 things that we were allowed to do, to go outside for, was to be active. And I think that understanding is something that we ought to return to, and that belief that this matters and is important. Because I think there is a challenge for us all, that in the national statistics that we've been collecting since March, we don't have London-specific statistics yet, although we do have the latest of our active life surveys coming out in a week or so's time. But nationwide, the most recent data we have from mid-September indicates that activity levels remain much lower than they were pre-COVID, considerably so, but also have started to decline over this period as well. We're now seeing a situation where just under a year ago, we had nearly 2/3 of the nation saying that they were doing at least 150 minutes a week of moderate intensity exercise, the chief medical officer definition. That's now down to around 29% of adults who are saying they're doing at least 5 times 30 minutes a week. And I think we need to understand too, that within that, that's having a particular impact on our children and our young people, with 15% of children are doing no weekday activity outside of schools. Within that as well, and to the theme of this conference today, there are participation gaps around disability, around gender, around race, and I think for more than anything, a recognition that is social economic circumstance still that is one of the biggest determinants of whether people have the opportunity to be to have activity in their life. So with those numbers where they are, and that's despite, I think, an awful lot of work, the incredible work that has been done to try and maintain activity levels, whether that's the gradual opening and return to play of sport that we've seen over the past months, the fact that in many cases still we've sought and worked hard to enable that to be exempt from some of the major restrictions, the fact that we've seen outdoor team sport largely retained, and indeed the fact that throughout this period, we've sought as Sport England and many other organisations and people too have tried to make the case for people thinking about ways to make themselves more active in their own lives on a day-to-day basis, whether that's finding new ways to get outside or indeed to do activity in the home. So I think one of the things that we should celebrate is the fact that we have seen the purpose and the necessity of activity, but worry about the barriers to that, and worrying particularly about the inequalities that make those barriers even worse. And I do say, as I say, want at the same time to recognise that that extends just beyond the impact of COVID-19. Those stubborn inequalities were there before. The consistent data that we had seen as Sport England over the last few years, where activity levels were rising as a whole, but where you looked at it from a position of gender, even though we made considerable strides, not least I'd like to think through the This Girl Can campaign and other things that we collectively achieved. The gender gap is still there. The fact that disabled people, again, despite a moderate rise that was starting to be very encouraging at the end of last year, disabled people and people living with long-term health conditions still have considerably less opportunity relative to others. And the fact, as I say, the last 3 or 4 months or 5 months now have been brought more sharply with the Black Lives Matter campaign, but essentially how we are looking to address race and racism in sport is a really important factor in this as we move forward. I had the chance last week with my opposite number at UK Sports, Sally Monday, to talk this through with number 10 Special Advisor on race and civil society, and think about some of the work we're looking to do in this area, not least understand and listen and learn a lot better than we have as organisations in the past, what the challenges are and how we can work differently to address them. And I think also at the start of the year, the Sport for All research that Sport England commissioned and we launched back in January is a particularly important staging post for us, because for the first time that looked at the issue of race and racism in sport through a much more granular focus, and didn't just think about the situation for Black, Asian and minority ethnic groups as a whole, but actually looked at the very different circumstances and the very different factors that came into play for different ethnic groups. So we do have a rich amount of learning and a rich amount of understanding of what the situation is, but we can and should have more. And I know that quite a lot of this is going to be picked up by colleagues of mine over the course of a few days, so I'm not necessarily going to focus too much on that now. But one of the areas which I would point out, because not least there are a couple of our local delivery pilots in the London area, in Hackney and in Southall, is that we have over the last few years in Sport England started to think differently about how we can work and how we can engage with local communities and how we can genuinely make lives better and different for people who are currently not being able to benefit from sport and physical activity. The local delivery pilots are where we have sought to work with the local communities, and in 12 areas of the country, very, very different, but united by their common belief that actually it's the situation on the ground that we should look to affect, and work with partners who actually understand the challenges in those local areas to think and behave differently about them, the services and the provision of sport and physical activity in those areas. And I think a lot of lessons that are coming out of the local delivery pilots, as I say, Hackney and Southall being two very good examples, where we can pick up during the week with some of the themes that can help us understand more how we can tackle the inequalities that are there. Beyond work like the pilots, I thought very briefly it'd be worth highlighting what we're doing in terms of the COVID pandemic, and how we can make sure that the resources and the efforts that we collectively can make are focused as much as possible on areas of greatest need. Overall, we have put an additional £210 million from Sport England's lottery funding into our response to COVID-19. That's over and above that which we were already investing in this year and next. A large proportion of that actually is still to be maintained into next year, where we're looking to essentially roll over our funding of about 120 key partner organisations, including London Sport, for another year. So there could be some certainty allied with a much more flexible approach to how that money is being spent. Now, that might sound like quite a technical point, but actually I think those organisations, the governing bodies, the local partnerships, the active partnerships, and the really important sporting organisations across the spectrum, Sporting Equals being one of them, for example, you know, we can feel very much we're in a position where we can at least give organisations some certainty at this difficult time with that resource and that money. Outside of that, we also have focused very much our attention on areas where we think we can make a difference with immediate short-term support. So we put together a £35 million package of a community emergency fund, which looked very much to support local clubs and communities. And I was delighted, actually, by the take-up of that. We had over 11,000 awards made over the period, 623 to be precise, of community sport organisations in London, totaling nearly £3 million of investment from us in helping to support them over the short term. And then a further 20 million has been invested in a fund called Tackling Inequalities, which is really the key one for me to focus on today, where we absolutely recognise that we are not best placed as Sport England to know where to put the resources that's needed to most enable to get to those community groups, those organisations who absolutely can make the biggest difference to people's lives. So we've actually sought there with money to devolve that out to many organisations working in local groups and communities, whether that's on a national basis, so an organisation like Street Games or Sportive, or indeed the active partners, London Sport being a classic example of that, who know their organisations focus, who know their region, and can best therefore make sure the money is in the right area. And I think the last thing that I would also say about the partnership we can have in London and with London Sport is a great example too of how we've been able to coordinate better partnership working. And I think joining the dots often is one of the most undervalued areas of where local partnership working can come to the fore. You know, for example, in the last few months, we've been seeing in London some in-depth mapping of facilities opening across London and exploring the flexible use of those spaces, whilst also supporting leisure providers in some of the boroughs to meet the challenges of service provision and contractual arrangements during this very difficult time. And we've also been collating and sharing some active at-home interventions that I mentioned earlier for children and young people in particular, and working alongside partners like London Youth to support those grassroots providers. And as I said, as you're going to hear later on in the week, some of the work going on specifically in terms of partnership and joining the dots in Southall and in Hackney have been really impressive. Southall is developing a movement known as the Active Communities Campaign, which has recruited over 30 organisers and has started with 250 inactive people scaling their work, using actually a specific focus and business model to really engage those people in seeking to help them to build activity into their lives. And the Hackney pilot has a particular strong focus on community engagement and co-design as well, mapping their stakeholders and focusing on building their relationships to bring together residents and local organisations that can play a part in increasing activity levels. I think when really looking at how we can seek to tackle inequalities, we also have to recognise that the challenge of now will also be the challenges of the future. One of the things that's very much on my mind at Sport England is the next few months of decision. First, we have the government spending review, which will come to conclusion hopefully in the next month or so. Is a key one in terms of social economic circumstance and the demographics, as well as the geographical factors that we're seeking to address. And we've made a strong case for continued investment in sport and physical activity by the government through the spending review. But another thing that will happen before the end of the year will be the development and conclusion of our new strategy at Sport England, where we'll look actually to put forward a vision for the next decade, but focus very much in terms of delivery on the immediate, relatively short-term focus of the next year or two. And tackling inequalities is really the prime focus now for us of where we think our strategic ambition and focus should be. As I said earlier, the learning and collaboration of the last few years, most notably from the local delivery pilots, has really shown us that we have to think and behave differently in order to make sure we reach communities who previously been less well served by the sport system. And actually going forward, that focus on making sure that we have disproportionately invested in our ambition there will be a key factor in our strategy. In thinking about, for those of you from a health background, of which many I know will be there, how Michael Marmot has expressed his principle of proportionate universalism, where of course, in looking to provide for a more active nation, you have to be universal in your thinking and universal in your approach, and to a degree, universal in the systems and the services that you provide, but disproportionately focused on communities, disproportionately focused on both geographic and demographic factors where there is greatest need where the barriers are highest and where the inequalities are so embedded as to be really needing a different way of thinking and working to overcome them. And so I think as we move forward towards the end of this year, I hope and think that many of you interested in where Sport England's focus is headed and where we've learned from the last few years in particular, is that we know that we have to think and behave differently if we're actually going to tackle and overcome the inequalities that have been there in numbers of activity levels and the way in which people are active in the years to come. So I hope and think that what I've done there is provide a sort of benchmark really for the focus that we've all collectively got, that we are in very, very uncertain times, that there are factors beyond just the pandemic that we have to overcome, that we must recognise that the inequalities in sport and physical activity, whether that's in organised team sports in local communities, whether that's in the local provision of sport, of gyms, swimming pools and leisure centres, whether it's across the sport for development sector, whether it's looking at our ways to work differently in place, whether that's in cities like London or in some of the other areas of the country that are less well served. Tackling inequalities has got to be at the centre of our ambition and our approach. And I think there is, for me at least, a real need to reflect on where we are in terms of the short-term challenge versus the long-term opportunity that collectively we have. I've been struck recently, and I'm going to use it again now, by a quote I found from an American admiral called James Stockdale, who was imprisoned by the Viet Cong during the Vietnam War for nearly 7 years in some horrendous conditions. And when he subsequently reflected on his experiences, he said the following: "You must never confuse the faith that you will prevail in the end, which you can never afford to lose, with the discipline to confront the most brutal facts of your current reality, whatever they may be." I think there's a very powerful message in there for all of us today, in both thinking about this conference, thinking about the environment in which we're working and living, and thinking about our collective and common desire for this to be a more active nation, for sport and physical activity to play its role at the heart of our well-being. Because I think there are some brutal facts of now that we need to address and overcome. That is our reality. But we mustn't only think of that. We must also look to the longer term and have faith that we can create a more active nation that is actually fairer, more equitable, and where ultimately the resources that collectively we bring are more evenly distributed to tackle the inequalities that we know continue to exist. That's where I hope we spend the focus of this morning. That's where I'm sure we'll go in terms of thinking about the health and well-being agenda. But mostly, thank you very much for the opportunity to be able to start the conference. And I hope you have a really terrific day. Thank you.
Tim, thank you. That was a fantastic context setting for the entire 4 days, Tim, so hugely appreciated. I know you're staying on and will be part of the panel Q&A at the end. And I'm sure some of the points that you picked up there will be picked up throughout both this session and throughout the 4 days. You mentioned around Michael Marmot, and I suspect we'll talk about that through the presentations and perhaps pick up in the Q&A too. But what I'll do now, if it's okay, is pass straight over to Dr. Tom Coffey. So Dr. Tom Coffey, OBE, who's joined the Mayor's Office as Senior Health Advisor in 2016. Tom's a GP. So I think on behalf of all of us and the rest of the country, we would like to acknowledge our appreciation and gratitude to the work that you've done, Tom, and your colleagues have done, and all frontline workers, whether they're in health or care or food supply across the course of the last 6 or 7 months. It's all been hugely appreciated. But so Tom's a GP from South London. He's also clinical lead with an interest in mental health and children's services, and has a role in terms of clinical leadership across emergency care in London. So extensive experience. So we'll look forward to hearing from Tom. The only block that I could find on Tom's copybook was that he's a season ticket holder of Chelsea, but we shall try not to hold that against him for the course of this presentation. So over to you, Tom.
Sean, thank you. Have I got an echo? Can you hear me, Sean? Yeah. Okay, fine. Okay, so first of all, thank you, and I'm here really on behalf of Sadiq Khan, Mayor of London, who everybody knows him, will know he's passionate about sport. So plays football and tennis every week, cycles and runs, and he recognises the benefits that sport plays to both the physical and mental health of Londoners and people in the UK. Can I have the next slide, please? Sadiq's got an ambition, and this was very much carved a bit by Sean, I have to say, about London being the healthiest global city. Now, how can we make sure that we can improve the lives of Londoners to be better than New York, Berlin, Paris, Madrid? And very much aware that the only way that can be achieved is by addressing health inequalities. And Sadiq's got a few ways of doing that. The first one he would say is health and all policies. He realizes he doesn't own the health service, but he can have a massive impact on many of the areas that he does control, planning and transport, etc. Also, he's got the duty to have a health inequality strategy. And how can he use that to address the amazing health inequalities that still exist in London? But also to sponsor and be an advocate of a number of projects. The one he is very proud of is one about a dementia-friendly London. Can London be the first dementia-friendly global city in the world? And he would hope that many of the things he does is to try to increase both sport, participation, and activity. So by doing that, he can improve London's mental health, our physical health, reduce our diabetes and cardiovascular disease. So it's something he's very keen to do. And next slide, please. Health and all policies. Sadiq controls planning, transport, housing, culture. And he's very keen to make sure that he can use these strategies to improve health and address health inequality. The one I initially pick out here is transport. His transport strategy is not about tubes and buses, it's about cycling and walking. How can he make sure that everything he does improves cycling and walking by implementing his transport policy? He's a real believer in public health and then try to embed public health in all of these departments so everyone has a expertise to ensure they can make sure there's health in all policies. Next slide, please. Something he's very proud of, the ultra-low emission zone. How to make sure we improve London's air quality. 9,000 Londoners die prematurely because of poor air quality. The poorest Londoners live where the poorest air quality is. The poorest children go to the schools in the worst air quality in London. So by addressing air quality in London, he's addressing inequalities and making sure he's improving the health of all Londoners. Since it started about 18 months ago, already there's 13,500 less journeys in London from polluting cars. Next slide, please. For Transport for London, he recognised that by using some of the power he's got in advertising TfL, the largest advertising contract in the capital, he looked at Amsterdam, where the leader of Amsterdam, the mayor of Amsterdam, said, I will use all my powers to form a coalition against childhood obesity. And I worked with Sadiq and we gave him 3 options. Option 1, ban advertising on healthy food at school travel times. Option 2, ban it in the outer area where most children go. Or option 3, ban it on the whole tube network. And he said, Tom, we're going to do it properly. Let's ban the whole system. The whole advertising of unhealthy food on the tube and bus network could potentially lose millions of pounds. But he was very keen. If you're going to do it properly. In fact, what's happened is that the advertisers previously of unhealthy food haven't pulled their advertising. They've actually started advertising their healthy food products. So it's a win-win of removing unhealthy advertising and replacing it with the advertising of healthy food products. And we would hope that would go a long way to try to start addressing childhood obesity in London. Because London has the most obese children in the country, and the poorest children in London are the most obese. Again, addressing health inequalities. Next slide, please. When we do our planning, we devise a system called Healthy Streets. What can we do with streets to make them more likely to take exercising, to walk, to cycle? And people gave us our feedback. They wanted it to be better air quality, shade, places to rest, feeling safe. And so by designing these healthy streets throughout London, this is our way of making sure we improve activity, improve sport. We've now got 500 TfL and borough, staff trained on healthy streets, and 18 healthy street officers in the boroughs in London trying to promote healthy streets and part of our planning. It's also very linked to our school super zone project. Around schools, we've got a 400-metre ring where you get improved air quality, safer streets, water-only schools, increasing cycling, to make sure that these schools, the school super zones, are increasing for London. And many, many parents now are asking for their school to be in the school super zone. Next slide, please. So planning is a key part of Sadiq's armoury to improve health. Sure, we can use his planning powers to do all the things that I just mentioned. So this isn't about commissioning the health service. This is making sure the environment in London is designed to address health inequalities and improve health. And his planning powers are making sure we can do that. Next slide, please. Violence is an enormous problem in London. In the last 12 months, we've been very convinced, in Glasgow's example, again, a public health issue, public health approach to violence reduction. It's not just about locking up criminals, it's about making sure that the primary prevention for all children reduce the risks of crime. Secondary prevention, people who are targeted because they've been a victim or an assailant in crime. And again, of course, the tertiary prevention using the criminal justice system. But recognizing we can have a public health approach where violent crime can be contagious. There are risks that we can address. There is a primary, secondary, and tertiary care approach to violent crime reduction. And this is something that Sadiq has said, it's going to take 10 years. It's not going to happen overnight, because for over 10 years, he hopes by this approach, we can fundamentally change the levels of violent crime in London. Next slide, please. We have appointed a clinical lead, Martin Griffiths, a trauma surgeon and head of the trauma at the London, a person who sees the benefit of sport in addressing violent crime. So taking part in sport isn't good for your health. It actually has been shown to be a very good vehicle to reduce violent crime in London. And Sports Unite is a new project that he's started over the last 12 months to put his money where his mouth is, to say how can we invest in sport activity in a targeted way to increase young people's engagement and reduce their likelihood to take part in violent crime. Next slide, please. So there's been about a plan for a £9 million investment over the next 2 or 3 years to look at how we can invest in sport using the Active Londoners Fund to make sure all the small projects which have been evaluated to show they take children off the street, away from the likelihood of being engaged in violent crime at those very early steps, and to make sure we use sport and activity as a way to address an issue which London recognises is very adversely affecting our Londoners and impacting on our poorest Londoners. Next slide, please. The Daily Mile, something again, as you can hear, I think Sadiq would say he's about 2 inches ahead of Mo Farah in this race. It didn't end that way, mind you. And Steve is very keen that he is a sponsor of the Healthy Schools London, where you can get a bronze award, a silver award, or a gold award, to make sure that we carry on this project to ensure we use school-based approach to improve activity, reduce obesity. The Daily Mile is one of those iconic measures and comic activities to ensure children are more active. As you will see here, we've already got over 800 children, schools signed up since the launch over the last kind of 18 months. And again, this is going from strength to strength as schools come back after COVID. Next slide, please. This now is hot off the press, which I think Sean is aware of, is the impact already over the last few years of our air pollution measure, what Sadiq has done for London. And you can see here a 94% reduction in the number of people living in areas with legal levels of nitrous oxide. The number of schools in such areas falling by 97%, falling from 155 to only 14 over the last 3 years. This, he feels, is not only improving the health of London, but making people more willing to exercise and take activity outdoors. They've got confidence in equality, they'll be confident to be active. Next slide, please. I can't finish my talk without mentioning COVID, and then we all know how has COVID on our outdoor activities. But also, it's a project called Street Space for London. So we're very keen that we do not get a car-led recovery for London. We want to make sure that we make the streets of London safer so people can do that shift at the moment of public transport to walking and cycling to make sure our public transport is safe. To do that, we've got to improve the infrastructure. And Street Space for London is making sure we're having all these pop-up cycle lanes. Now, I can't claim that every single lorry driver, car driver, or van driver is happy with these cycle lanes. But we have to make this change if we're going to make sure that we have a sustained increase in cycling and walking in London. Next slide, please. Social prescribing is one of the new projects that Sadiq has been very close to over the last 3 years, working with GPs to use the GP interaction to prescribe activities for our patients. And one project we've done in 3 boroughs in London is called an Active People Challenge, referring people onto a project to actually use their daily lives to gradually increase their activity. Not about sending to the gym or a 5-mile walk, but into motivational coaches to work with these people to try to gradually improve their activity. Next slide, please. And again, these are some of the comments and outcomes of that project, showing that making slight daily changes can have a big impact as we try to move every Londoner to 20 to 30 minutes every day of activity as part of our health and equality strategy. Next slide, please. Inequalities are also very sadly affecting Londoners from COVID. Initially, people were saying that COVID is a great leveler. We're all going to be impacted by COVID. But very quickly, we realised the poorest Londoners are the ones most affected by COVID. Our baby community are the patients who are most likely to get COVID and the most likely to die from COVID. So health inequality sadly also has a massive impact on how COVID affects Londoners. Next slide, please. Sadiq, 2 years ago, launched his health inequality strategy. His previous mayor had about 58 priorities. Sadiq chose just 5. But I want to choose 5 big impact areas. Healthy children, starting a new early years scheme for the 13,000 early years settings in London. Healthy minds, making sure every single school in London has a mental health first aid trainer. Healthy places, improving air quality in London. Healthy communities, making sure we use social prescribing to improve the wealth and cohesion of our community. And also healthy lives, making sure that we are able to encourage all Londoners to be active for 20 to 30 minutes a day by using our planning strategy, our transport strategy, our housing strategy to make sure all we do will work towards that increase in activity for all Londoners. Next slide, please. I want to finish on the idea of London being a national park. I'm sure many of us spend our time walking around national parks, getting our activity, and feel that you have to leave London to go to Derbyshire Downs, to South Downs. And London is now a national park city. London has got increasing amount of green spaces. We're using our planning laws to gradually make sure that all Londoners have access to green space, where they can be active, they can feel safe, they can breathe air of good quality. And the National Park City Festival was started in July last year. Next slide, please. And this shows some of the many activities at the festival. There were 373 events throughout London, trying to promote the idea that London can be an active city. And Sadiq is very keen. When he talks about health inequalities and addressing health inequality, one of his main aims is to improve the activity of Londoners, that all Londoners do 20 to 30 minutes of activity every day. We will make sure that the poorest Londoners, where inequalities exist, have the same access, ability to exercise as well. So thank you very much for giving me your time and sharing with you Sadiq's vision for London to improve activity and address health inequalities. Sean, thank you very much.
Tom, thank you very much. And I can see by your background, I think you're in your GP surgery. So special thanks for joining us in the course of the middle of your busy day, I'm sure. A huge array of interventions you've just outlined there, which again we'll pick up through the course of both this session and sessions throughout. The hot off the press improvements in air pollution look absolutely amazing, so that's brilliant. As a segue into the next presenter, you mentioned there around childhood obesity and the wider determinants of health and the impact that we can make on it there. So I will introduce the next speaker now, but thank you again, Tom. Just before I do introduce our next speaker, could I just remind people potentially that didn't join us at the beginning, so there's the ability to post questions throughout these presentations, which we'll do a Q&A session at the end of 20-25 minutes. I think there should be an icon on the bottom left of your screen where you can post any questions. And I would encourage people to do that during the course of the presentations, if possible. But without further ado, can I introduce our next speaker? And so it's Dr. Snehal Pinto-Pereira. So Snehal is a lecturer in population health and applied statistics at UCL, so University College London. She's authored numerous reports for the UK government and the Department of Health and Social, and co-authored both ones, and has a particular interest in obesity, which follows on very nicely from Tom's presentation. So without further ado, I'll pass over to Snehal. Thank you, Snehal.
Perfect. Hi, thank you. Perfect, my slides. Yes, so I'm Snehal Pinto-Pereira, and I'm a life course epidemiologist. So what that means is I want to understand how we got to where we are. So for Tom's already spoken about the fact that we know that there are social inequalities in COVID-19 related health outcomes. But I want to understand how we got here and what we can do to prevent these things from happening again. So during my presentation, which will be 15 minutes or so, I'm going to give you the work we've done with respect to social inequalities, physical activity, and health more generally. Okay. So yes, as with those things, I think we need to start in early life. And just a disclaimer over here, these are pictures of children because I told them they were quiet and let me work on my slides and I'll make them famous. And so I hope I fulfilled my obligation here. So next slide, please. We've done some work trying to understand between early life factors and physical activity in adulthood. And found that compared to those born in the highest social class, those born in the lowest class were about 23% less likely to be active at 15. And this is after we took account of, many adult factors that were important, such as their own social class, BMI, their physical and mental health, and so forth. But then we started to dig a little bit deeper because physical activity, it's a behavior and it can change within individuals as they age. And so while it's great if someone is active in their 20s, I'm interested in making sure that that person is active in their 30s, 40s, 50s, and, for their whole life, basically. And I want to understand encouraged people to adopt and maintain physical activity across a lifetime. Next slide, please. And so when we started thinking about stability and change in activity patterns, we found that compared to the highest social class, those born in the lowest social class were about 30% more likely to deteriorate to inactivity between the ages of 33 and 50. And again, this was after we accounted for adult factors like their own social class and their BMI and the physical and mental health and so forth. Next slide, please. Then when we turned our attention to adulthood, what we found was compared to those who had a degree, those who had no qualifications were about 41% more likely to deteriorate to inactivity between 33 and 50. And this was after we accounted for all the stuff that I previously showed you on the previous slide that we found that was important, such as their social class at birth, your parents' education, and so forth. So next slide. If we take these two slides together, the main point that our work so far has shown is that differences in adult physical activity levels, they're not entirely explained by adult factors, and that influences from prior life stages are important. And when you start looking, you'll see this theme occurring again and again and again. Because here, I've just shown you the importance of early life and adulthood for physical activity. Next slide. But I want to emphasize that considering the whole life course is important for health more broadly. Next slide, please. And this paper over here, it looked at disease risk at 45 by childhood social class. And you can see that I've highlighted in that blue box that even after the adult social class of birth was related to a whole host of biomarkers for health, such as blood pressure, BMI, lipid levels, and so forth. Next slide, please. And again, likewise, when you looked at adult social class, even after you accounted for childhood social class, adult social class was related to all these biomarkers for health and disease as well. Next slide, please. So the main point here, just like in the previous slide then, was that we think that the influences on adult health and disease are found in both childhood and adulthood. Next slide, please. So far, I hope I've convinced you of the importance of social class across your life course for health. But it's not just social class then that needs a life course perspective. Things like how and when you gain weight also matters. So for example, for your health, does it matter if you gain weight slowly and steadily over time, or you have a rapid increase in your weight? And we tried to understand how different types of weight gain patterns were associated with your lipid levels in adulthood. Next slide, please. Right. So we found that people who gained weight rapidly between 23 and 45 had higher levels of LDL cholesterol. So just if I wanted to say that another way, what I'm saying is that for the same BMI at 45, the people who had the highest LDL cholesterol were the ones who gained the most BMI between 23 and 45. So the point here is, next slide, please, how you get to where you are, it matters. Okay, next slide, please. So then turning to something a little bit different now to talk about sedentary behaviors. I think there's a lot of discussion about sedentary behaviors at the moment, but I think we need to be more nuanced in the narrative that we're delivering, because we need to acknowledge that sedentary behaviors happen in different ways. You can sit down when you're at work, or you can sit down during your leisure time and, watch TV. And that's what we looked at in this paper. Next slide, please. And the first thing that we need to acknowledge is that the domains in which sedentary behaviors happen are socially patterned. So for example, we're able to show that as TV viewing time went up, so too did the proportion of people who were born in a manual class at birth and had a manual class in adulthood. On the flip side, as the proportion of time spent sitting at work went up, the proportion of from a manual class at work went down, as too did the proportion of people who had a manual class in adulthood. And then just to finish off this slide, can I have the next slide, please? Yeah, just to finish it off, when we looked at how TV viewing and work sitting were associated with a whole host of biomarkers, right away you can see that work sitting wasn't associated with any of the biomarkers we looked at, TV viewing was associated with triglycerides, HDL, CRP, and so forth. Next slide, please. So I just want to talk a little bit then about COVID as well. So my colleague Mark Hamers recently published this nice paper on lifestyle risk factors and COVID hospitalization. And they were able to show that compared to the people who did sufficient activity, those who did no activity were at a higher risk of being hospitalized for COVID. But unfortunately, in this data set, they didn't have data to determine whether the variation in physical activity levels that were being observed were explained by what's gone on before in these people's lives. And next slide, please. I think I want to explain why a life course approach is important for COVID research, because we know that COVID disproportionately affects the disadvantaged. So the disadvantaged, for example, are more likely to live and work in overcrowded conditions, and that makes it easier for the virus to spread. Next slide, please. But this graph here illustrates why early life matters. So COVID is particularly detrimental in those with compromised lung function. Now, this graph shows that lung function develops and changes over a lifetime. So your capacity is increasing in early life, it's stable in young adulthood, and then it declines at older ages. And currently, we're looking at people on the right-hand side of the graph. I hope it's the right for you all as well, the older ages. But overcrowding and poorly ventilated housing in childhood can lead to respiratory disease, limit one's peak lung function. So instead of, for example, going along line A, these people could be going along line B. And you could have a whole bunch of adults right now walking around who aren't even aware that they haven't reached their maximum potential lung function because they're going along line B instead of going along line A. And that could actually put them at a higher risk of poor COVID outcomes. And so next slide. When you start thinking about it and you start looking, you recognize the value of the life course approach for many things. So it's been used to talk about, next slide, cognition. It's been used to talk about, next slide, non-communicable diseases, and it's been used to talk about, next slide, sarcopenia. And that's just to name a few things that it's been used to talk about. Next slide, please. And so I hope I've convinced you then of, well, three things. The value of thinking more deeply about the types of behaviours and acknowledge that they can change with age and they're socially patterned. Then also to recognise that adult health and physical activity, they're found not just in adulthood, but in childhood as well. And also finally, I hope I've convinced you of the value of a life course approach to health, because I think how you get to where you are, it matters. Next slide, please. Oh yeah, I was going to say if you have questions, you could ask me now, but I think we're actually going to do that at the end, so scrap that slide. I'm done.
And essentially shows the wealth of data and scientific evidence behind some of the thinking and the kind of broader determinants and wider determinants. So thank you, that's really, really interesting. So equally, again, I'm going to move us straight on if it's okay, so then we can have ample time for Q&As at the end. So I think continuing a kind of broader thing, could I introduce Dr. Mike Brannan next? So Mike's a public health consultant who is part of the National League for Physical Activity and Healthy Weight at Public Health England. He equally has authored a number of reports, including a National Physical Activity Framework for England, Everybody Active Everybody Active Every Day, and contributed to the CMO Chief Medical Officer report forum last year in respect of physical activity guidelines. So he's kind of an expert in his field, but equally I know has worked across leadership roles in health inequalities, transport, sustainability, housing, employment, and others. So kind of brings the breadth of knowledge too. So Mike, over to you if I can.
Thank you very much, Sean. Thank you very much for having me. So in my talk, as I say, you know, I'm talking about it's been the best times and the worst of times for physical activity, because I wanted to recognise, although it's an unprecedented challenge for the sector and particularly the individuals working in the sector, actually we should take heart in terms of the strength and what we've achieved and what we can achieve in physical activity and how important it is. So next slide, please. So we know, as some of the speakers have said, the importance of physical activity for individuals as well as our community. So we know that across the life course, it's important in children and young people for development, in adults for maintaining functionality, and as we get older, it's about sustaining that ability to be independent. And also, if we look at actually the work that Sport England have also done about, what we know about the wider benefits for individuals and communities. So not only physical and mental health, but also individual development, social and community development, as well as economic development. So this demonstrates why physical activity is so important for our population, both as individuals and as a nation. So go to the next slide. I say it's important to recognise that it's been a huge success story in this country over the last 5 years, compared to internationally, where we've seen inactivity declining and increasing, and activity decreasing. We see in this country we've bucked the international trend, but actually over the last 5 years achieving an increase in physical activity and a decrease in inactivity. So should take heart in that, and in particular what other countries have struggled with is actually starting to reduce some of those inequalities gaps. So we see the gaps declined for gender, for age, for disability and long-term conditions, and also ethnicity. Socioeconomics is continuing to be stubborn, but I know everyone's working hard on that one, and that as Tim alluded to, there'll be a continued focus on that. So if we move to the next slide. I say it's important to recognise the strength and the value of physical activity. And this work that was published a few months ago demonstrated that there's almost £90 billion per year of social and economic benefits that physical activity brings to the country. So that's for £1 spent, almost £4 of social impact received for the country. And obviously from a public health perspective, almost 10 billion in physical and mental health benefits. So that's in terms of prevention of disease, but also reducing demand on social and healthcare systems. So actually there's a strong economic value of physical activity, and that gives us a basis for going forward. In terms of the next slide, as colleagues have mentioned, it is an unprecedented time for physical activity, internationally as well as nationally. But if we just look at the national data, we know that, and this is after the lockdown, where we saw obviously a big drop in the lockdown. We're seeing that this is from April to August. We're seeing that activity, so the green line, that's people doing 30 minutes or more on 5 days or more, that's starting to decline. And also if we see the inactivity, the bottom line, so that's people not doing 30 minutes on physical activity per day. This is actually slightly different to the definitions we normally use for activity and inactivity, but it gives you an indication. We can see inactivity levels rising. So as I say, there's an issue that actually they're starting, whilst it was hugely impacted by COVID, the trends are starting to go in the wrong directions as well. So in terms of the next slide, I just thought it'd be useful just to have this comparison about how we're doing in London compared to other parts of the country. So as you can see, the green bar, which is those doing the most activity, 30 minutes and 5 days or more, it's lower than other parts of the country. And we can see those active. Actually, it's great to see that bar being lower than other parts of the country. But we can see that actually we really need to think about what's happening in London and how we can make those improvements. So we go into the next slide. That's about the levels of activity in children and young people. Activity in children and young people were impacted much higher during the COVID lockdown than for adults. And we suspect that's due to types of activities that children use. The access to playgrounds was decreased. Organised sport, which children are more likely to be doing than adults, was basically disappeared rather than restricted. But we can see that actually they're starting to see improvements. So the key ones are that top dark blue one, which is children doing 36 minutes on a typical day, and the third one, the grey one, which is those doing 60 plus minutes per day, which is the recommendation for children. We can see both of those seem to be increasing. So that's great news. And if we look onto the next slide, which shows how we're comparing and how London's comparing to other parts of the country. You know, it's the ones we want to see looking good, as say, are those dark blue and the grey ones. So we can see that it's, you know, again, we could do with starting to improve a little bit there. In terms of the next slide, as mentioned, it's important to recognise that physical activity, COVID hasn't been a uniform experience across the population. So we know that some parts of the population, their physical activity levels were impacted to a greater extent, and in particular, unfortunately, these are the generally the populations who had inequalities already. So disabled people, people with long-term conditions, women, socioeconomic groups, etc. And I just thought I'd share this work from, which you may have seen from the We Are Undefeatable's work from the health charities, about actually we can see disabled people were much less likely to be active than non-disabled people, and we know that there was an existing inequalities there, but we can see that's exacerbated by COVID. In terms of the next slide, one of the things to think about, and we've been speaking this morning about it, about actually recognising physical activity behaviour. So actual participation really is only one dimension of what's of that behaviour. So as many of you will be aware, the COMBI model, you know, behaviour is defined by is determined by capability, motivation, and opportunity. So if we take away the opportunity, that's going to naturally have an impact on behaviour levels. So if we look beyond opportunity and look at capability and motivation, that's really important for understanding actually what's the potential to increase this behaviour again. And so if we look at the next slide, if we look at the latest data, and you know, I'll just we've talked about physical activity levels quite a lot today. It'd be worth thinking actually, as I say, about those opportunity and motivational factors that we know. As I say, this is why, you know, it's the worst of times, but also it's potentially the best of times, in terms of we know that actually those opportunity and motivating factors are very high at the moment. So 2/3 of people feel they have the opportunity and also the ability to be active, and a similar number have, you know, feel that exercise is important to them. These are starting to decline, but it's important that we recognise actually those two, capability and opportunity factors, are capability and motivation are increasing. So we just need to focus on getting those opportunities, and hopefully we'll see that increase in behaviour. So in the next slide, again, when we're thinking about supporting people to be more active, it's important to recognise actually what COVID and barriers and motivators in general are not uniform across the population. So just again, an example for people with long-term conditions, we know that there's a number of factors that have been constant from before COVID to now, in concerns around directly linked to their health and their condition. But it's important to recognise actually this population is more worried about coronavirus during getting active than the other sections of population. And if you think about it, that's not surprising, because this population have been shielding at during the lockdown, and we're probably likely to see this in other sectors of population who have a greater risk or have been shielding. So particularly older people, people from the AME populations, etc., and lower socioeconomic groups. So it's important whilst we work with people that we recognise people are actually in a different position. So their concerns and their motivators will be slightly different. So it's important to work with those individuals about where they are. In terms of next slide, please. I thought it'd be useful to talk about actually what is the evidence about how we can address inequalities. So there's we know that actually interventions potentially have the opportunity to widen inequalities, not just reduce them. It's primarily linked to this differential uptake and maintenance of physical activity when you give an individual at both individual and group levels. So this is primarily linked to the capacity of those people to engage and also to sustain that activity, in particular socioeconomics. So I just thought I'd link to, as I say, two key studies. One which was done by the European Commission that came out a couple of years ago, and that looked across different interventions, that the evidence base for different interventions across the population. And as Tim alluded to, what they found was the importance of proportionate universalism in implementation. So that's about universal provision, but targeted to those based on need. So allocating your resource based on the need of that across your population. And then also, so that's about specific interventions, but also if we look at taking a place-based approach, the population intervention triangle is helpful here. So it's three key elements really. It's about civic level interventions, and that's essentially by the organised efforts of statutory bodies. Community centred interventions, so that's about building out a capacity in your community, and also service-based interventions, and so that's actually about the services that we're directly giving. So in terms of the next slide, I won't go into detail on them, but I just thought it'd be useful just to highlight some of the key resources that are available. So yourselves will be aware of many of these, but I think it's important to recognise that there's also some specific guidance available to support people to focus on the inequalities groups. So the return to play has from Sport England stuff has particular consideration for inequalities groups, BAME, low socioeconomic, people with health conditions, and also women. And also there's a lot of resources from the Activity Alliance about how we can focus on, in terms of reopening opportunities to physical activity, to focus on reducing inactivity rather than just necessarily working with the core market. If we look at the next slide, please. There's also resources that we can use in terms of engaging the public. So the government launched the Better Health campaign. So that's about utilising the reset moment, as people talk about, during COVID, because we know that people, the population, are thinking more about their health as a consequence of COVID and are more receptive to health messages. So that's why they launched the Better Health campaign. And physical activity is one of the key behaviours in there. Obviously, Tim mentioned the joining the movement work that Sport England have done. A number of the charities, health charities such as Versus Arthritis have done work, and also the We Are Undefeatables campaign across the 15 charities. And other work has been done nationally and locally, such as we sent over 500,000 active booklets. We worked with Sport England, National Centre for Sports and Exercise Medicine in Sheffield to develop a booklet that went to vulnerable people who are targeted. So in terms of the next slide, please. I just thought it'd be useful to highlight some of the work that we've got coming out. So we've worked with the University of Derby and London Sport have kindly supported this work in terms of creating evidence-based guidance to understand and address inequalities in a local area. There's the Easier to be Active, a national conversation, a co-production of a resource which many of you may have been involved in. This is about trying to make it as easy for somebody with a health condition to engage in community physical activity as it is for anyone else in the population. And also to support that, Sport England ourselves and the Royal College of General Practitioners are doing work led by the Faculty of Sports and Exercise Medicine to develop a risk consensus statement for people with with health conditions engaging in physical activity, because we know that for the vast majority of people with long-term conditions, they have no greater health risk than somebody with the same fitness level who doesn't have a health condition. So we need to support the system to help them realise that there is that evidence base there to work with people with long-term conditions. So in terms of the next slide, please. I just thought it was important to, and I think this resonates with what colleagues have said. In terms of Nelson Mandela talked about the power of sport, and I think this, particularly during the COVID context, this is why it is so important. So he talked about sport having the power to change the world, the power to inspire, the power to unite people, the power to youth, and also to create hope. I think all of those things are things that actually we really need in the community at the moment, and that's why sport genuinely is uniquely positioned to help. So just in terms of just to summarize, I think it's important that we do recognise the stress that and the impact that COVID has had on the physical activity sector and particularly its workforce. But as I say, we should take heart about actually it is a huge success story over the last 5 years, and that gives us every reason to believe that actually we can continue that success story. We need to seize the moment, as I say, the population, whilst they might not be engaging in physical activity at the same level because the opportunities aren't there, we can see that the motivation is there and that belief in their capability is potentially increasing. So we need to seize that moment. And also, as I say, as we support the population to get more active, we focus on reducing on proportionate universalism, if you like. We need to focus on those inequalities groups to particularly target and support them, as well as the mass market, as we'd say, those who are going to be active anyway. So, thank you very much.
Mike, thank you. That was an incredibly interesting and informative presentation, so huge thank you. We're now going to move to the Q&A session. So a reminder for delegates that are watching, you can post your questions. We've got some questions come in, which we'll go to in a second, but you can post your questions. There's a small icon on the bottom left-hand side of your screen if you want to post a question, and I would encourage you to do so. It's not very often that we get such a rich mix of people across to do the Q&A. As I reflect on what we've heard thus far, there's been a couple of mentions to targeted universalism and Michael Marmot, and I was kind of reflecting, I guess, that pre-COVID-19 pandemic, although it feels an eternity ago, but at the end part of last year, the early part of this year, so Professor Michael Marmot issued an updated research study which essentially said that the increases in life expectancy across the board had stalled, and it's the first time in about a century, and health inequalities were growing. And that's pre-COVID. And then COVID hits, and as we've just been hearing, it has shone a light on and exacerbated health inequalities and inequalities more broadly. And I think the COVID pandemic and other kind of broader societal shocks, if you like, if that's the right expression, such as the killing of George Floyd, mean that there is a moment now for us to turn this into a movement to make meaningful change in respect of health inequalities. And you've already heard some fantastic work that's going on, and so there is much cause for optimism in the work that we're all doing and that you are all doing too. So I will go to the questions now. Before I do, I'll take a complete liberty as chair of this session and ask my own question, if that's okay, to give me a chance to read the other ones. And it's just a nice, gentle warm-up question, which I'm going to throw at you, Tim, if that's okay to start with, but would welcome other contributions too. But so my question is, what's been the biggest challenge to come out of the COVID pandemic for the physical activity and sports sector, and how do we overcome that?
Nice, gentle question indeed, Sean. And thank you to my fellow colleagues for so much richer information this morning. I think the challenge has been, I mean, there are the thing that I would most focus. There's probably two elements to the answer. One is a general one, which is that I think we are now challenged very much to understand what our own definition of building back better from this pandemic is in relation to tackling some of the systemic challenges that we all faced before. Because Mike's summed it up quite nicely in talking about, the progress that we'd made being halted. But what we weren't seeing necessarily within that was substantial shifts in some of the inequalities that we're seeking to address. And I think whether this is in the facilities space, whether this is in the structures, whether this is in the historical ways in which funding works, the ways in which local authorities engage with sport, the ways in which schools engage with sport, this has all been massively and significantly impacted by the pandemic over the last 6 months. And I think the challenge is going to be, how can we deal with what is an incredible fragility right now in terms of economic circumstance for so many people, both personally and organizationally in sport, in terms of the fragility of the opportunity every day. And today isn't one of those days. You have the feeling that maybe things are going to step backwards or forwards in terms of what's possible, and the rules and the guidelines and the restrictions. All of that is mixed in right now for a sense that we just have to sustain and hang on to as much as we possibly can because of the risk otherwise. And that sense of fragility necessarily and rightly makes people want to just retrench and get back to where we were. But actually where we were is not where we need to be. So if I'm hopefully being clear, I think the real challenge that we face is not existential, but it's slightly beyond the here and now. It's that, how can we deal with the enormous problems of the pandemic that's created now for people in terms of the sports infrastructure, the sports system, and how people build activity into their lives, but also do so in a way that structures better how we can deliver it more effectively for everyone in the future, because those are not incompatible, but they are equally not the same things. My secondary point is actually to narrow it down, which is children and young people. And I think that the biggest challenge perhaps that we should all be facing up to is both within school and out of school, not only the massive drop-off that has happened as a result. Mike, various people mentioned it, but Mike gave the figures explicitly. We are in a position now where we are genuinely in danger of having a generation of young people for whom it's not an embedded part of their lives, where there is no focus for them at all on physical literacy, and where therefore the benefits are unlikely to flow into adulthood. And I think whether it's within schools or in that focus on how out of school, both in their family and their recreational time, we really do focus in as a sector on the health, well-being and sporting activity of our children and young people.
Brilliant, thanks, Tim. I'm going to flow on to that, hopefully, and I think this potentially is a question for you, Mike. But so there's a question on the chat around if the social return on investment of physical activity and sport is economically compelling, why is it still not being taken seriously by government, especially with our sector being the last to open after lockdown?
I think that's a challenging one. Obviously, I work for Public Health England, and so I can't speak on behalf of government. I think it is a case of actually, there is a strong case to be made for the sector. We, Public Health England, we work hard to try and make that case for the sector. And we'll continue to do so. As I say, it's I can't speak on behalf of the Department of Health and Social Care or the Prime Minister. So, but as I say, Public Health England, as you can imagine, we're extremely supportive of the role of physical activity and sport in the sector, both for, as I say, individuals, but also communities.
Yeah, great, thanks, Mike. I completely get that. And I guess it's a case of continuing to build the evidence and make the case and kind of creating the kind of bottom-up draw for it, if that makes sense. Tom, as a sort of representative of regional government, I might give you an opportunity to come in there.
Yeah, I think there's also a political difference between some of the parties about how much the state should intervene. And I think over the years, if you even think about childhood obesity, where it's taken many, many years for the present government to realise that you've got to create a society which is not obesogenic. And it's not just about people making the right choices. And I think it almost took Boris Johnson to undergo, a significant illness, which he knew was partially related to his weight, for him to realise that it is right to address obesogenic society, and also potentially to make sure society is designed and planned to make exercise and sport participation more easy to do. And I know that for the Mayor of London, he's very keen to use all his powers to increase sport and activity, because he sees also the great benefit for the improvement of mental health as well as the economic side as well. And I think sometimes you do get a slight philosophical difference between the parties. But I would hope that over time there's both the economic case but also the mental health case about sport participation and activity. And I think, if anything, that might be the one which tips the government to actually deciding it wants to make the planning system, the housing system, the school system, the leisure system make it more easy for people to participate. At the moment, there are too many barriers, too many financial obstacles, time obstacles, planning obstacles.
Great, thank you, Tom. And it equally reminded me of the kind of comment from Barack Obama around the inequalities are the defining issue of our time and are amenable to policy intervention. So the opportunity is there and the choices are there, and I guess it's a case of us supporting them being taken. I'm going to continue unless any of the other panel want to come in there, I will continue the theme in terms of kind of children, if you like. And there's a comment that says, really interesting presentation from Snehal Pinto Pereira. From a physical activity perspective, should there be more connectivity between planned interventions for young people's activity and plans for activity in older adulthood?
Oh, that's a great and very difficult question. I mean, I think the evidence is there to say that being active across your lifetime is hugely beneficial. Yeah. And also there is, it's the idea that it's never too late to start, right? It's never too early to begin and it's never too late to start, right? So if you can get children to be active and for them to continue being active across their life, that would be the ideal, and that's amazing. But there's nothing to say that you have an inactive 20-year-old, you can't target them, get them to be active, and they will reap the benefits later on in their life. How you do it is a different question, and I think that's very difficult to answer. Does that answer your question?
I think so, yeah. So essentially the point of you should never give, you should never stop not trying, kind of thing.
Yes, exactly.
Yeah, okay, great. Yeah, no, I think that does answer the question. Mike, you want to come in with the old-fashioned hand raise?
Sorry. Yeah, I just thought it was also worth noting that actually we know that, as Snehal said, we know that the association between being active during childhood and developing that physical literacy and the likelihood that you'll be active as an adult. But it's also worth recognising that actually people change over their life course, over their lifetime. So people's preferences change, their opportunities change, their barriers change. So it's worth recognising, where are and with public work on the life course and where are those lifetime events that cause people to drop out of activity. So whether it's the teenage years, whether it's starting work, whether it's starting to have a family, whether it's developing a health condition, whether it's becoming a carer, whether it's gaining additional responsibilities, either for family or other friends, it's worth recognizing that actually, we need to recognize that people's lives are complex and challenging. And we need to work with them and around them and provide that offer that works for them.
Brilliant, thanks, Mike. And that picks up a theme that was current, I think, for all the presentations, essentially around kind of place and people. And I can see, Tim, you want to come in.
Yeah, I'm rather liking this hands up. Yeah, I just want to build on both those comments very briefly, but I think we should really be conscious that to a degree there is a policy intervention here, which is the extent to which we are prioritizing activity and school sport within the curriculum, the way in which we determine that is resourced, the facilities base that it's used, the extent to which it's then measured, and the lack of current measurement of that within schools and Ofsted relative to other areas of a school's performance. That's all very what. There's also, for me, and I think this is where we should, as the organisations that we are, be more focused. There's also a massive intervention potential around how, which is the fact that it's very often the way in which sport in schools and activity is presented that is the thing that puts people off, not just its fact and its presence. Mike mentioned physical literacy. I think particularly our understanding from what drives genuine physical literacy is the enjoyment factor that young people have in relation to being active at school. And I think we have for years underplayed the importance of the inclusion experience, the experience of young people and their inclusion within it. Because for some, school sport is always going to be a brilliant thing because they're good at it and it's defining. But for many, that's actually not the experience. And so our job, I think, is not only to think about, well, how many hours are there and how's it measured and what's the facilities base and how all those technical policy interventions are thought about. But we should become more sophisticated about this and actually think about the experience of young people and their physical literacy.
Great. Yeah, completely agree. Thanks, Tim. Tom, I think you got your hand up.
Yeah. And in fact, for the older person, as a GP, I find that the easiest group to restart their exercise and activity, because often they have a number of life events, be it cardiac illness, hypertension, raised cholesterol. And very common that a patient will say to me, I don't want to take tablets. What can I do for my blood pressure, for my diabetes, for my arthritis, for my raised cholesterol? That means I can avoid tablets. And the easy answer almost every time is increase your activity. And there is someone saying, if we could put into a pill the medical benefits of exercise, every single person in Britain would take that pill. And so therefore the life event episodes which allow us to promote exercise is actually, I think, greater in the middle-aged and older person. And I find it much easier to persuade an older person to restart activity and exercise, to address an event and to avoid medication.
Great, thanks, Tom. Can I change the theme slightly? So there's been a few questions which I think are essentially around partnership working and the need for partnership working. So the one that springs to mind is, so what are the key factors in developing cross-sector partnerships to work collaboratively to tackle inequalities? And I'm going to throw that open and see if there are any comments from the panelists. Always high risk. Thanks, Mike.
So I can take that. So I think it's incredibly important, as we've kind of discussed, about partnership is critical. Nobody's going to achieve stuff across communities without partnership. So in terms of what's really important is recognizing what the needs and opportunities and limitations are of your partners, making it clear what how you can work with them, your offer, and also developing an honest and supportive relationship. And it's also it's important on that level in terms of specific interventions. But I think as Tim also alluded to as well, is we need to start thinking from local delivery pilots, we need to start thinking about that place-based and thinking more towards actually who are our potential pilots, and looking across the different elements of our community. So whether it's if you're wanting to target particularly around the people you're trying to target, whether it's children, about the schools and the parks, etc., older people, in terms of who are they engaging with, community groups, etc. So And so, that whole system's thinking about developing wider partnerships with, what you might call non-traditional partners is really important. And that's also why things such as, the We Are Undefeatables campaign, which, 15 health charities have come forward and are starting to really promote physical activity to the to people with long-term conditions, to encourage them to get more physically active. It's worth starting to think about actually, what are our potential partners doing, and how can we work with them and add value to that.
Brilliant, thank you. Again, I'm going to change tack, so I'm bobbing around a bit here, but I'm going to go to a question that Marcus has raised. So question for Marcus is, whilst talking about inequalities, I've noticed the lack of data around inequalities that LGBT people face in getting active. Do any of the panelists have any research or work planned to address this lack of LGBT people getting active?
You can talk as well.
Yeah, please, Mike, go first.
We looked at this in 2000, and when we developed Everybody Active Every Day, and we actually had an expert round table to look at LGBT issues and data, and there is a real dearth of data. There is an issue there, and so what we're doing and there are inequalities there. And so the work that we're doing with University of Derby, which is looking across all the protected characteristics, including LGBT, and it's going to be presenting the best data that's currently available for that. So we are really aware that we need to think across all inequalities to protect the legally protected characteristics plus socioeconomics.
Coming in.
Yeah, no, I mean, I would agree about the relative lack of data. We do have opportunity within the Active Life Survey. There is one element which I genuinely understand we need to do more to overcome around people's willingness to declare relative to other with the protected characteristics in historical data. But I think that is overcomable through making sure that the context and the approach that's taken is genuinely inclusive and sympathetic to the ambitions that we're trying to reach, which is to make life, and opportunities to be more active, more available to everyone. We do have a very specific focus within Sport England and a desire as part of a general strategic ambition to be more inclusive, to see that community equally well served. But Mike's right, the relative data is not sufficient.
Great, thank you. There's a question in the chat which is a sort of quite fundamental question, which is essentially around if people are struggling through other pressures and things that are going on in their life around work and having a roof over their head, then sport and activity is probably the last thing on their mind. And so I'm just interested in reflections. Perhaps Tom, you'll kick us off on this one in terms of the kind of broader and wider determinants.
And so what we recognise is that income inequality is a significant barrier to taking part in active sport. So too often, so many of the sports activities have got a cost attached to them, be it in the equipment or membership, but also the time. And in the Active People Challenge project, which looked at 3 boroughs, the thing which they found was the most likely to get people active was when you had people doing a one-to-one individual assessment with that person. So just giving out a leaflet didn't really happen. It required a person who had both motivational skills and ability to understand someone else's life and to build activity into that. And often the most key thing was building in walking as part of your travel. And by doing that, a first step towards sport participation, but it was the main first step about increasing activity, because also it can often save money if it's a tube journey saved or a bus journey saved. But inequality was significant. Also, there's a gender issue there where often, especially in the COVID, working mothers are the ones who've more likely to lose their jobs than men. And also there was found that working mothers were less likely to participate in sport because of just significant time pressures. And again, the Active People Challenge program was saying how you build into your daily life the activity rather than making an additional activity, because then that both had a time pressure which you didn't have or a cost pressure you couldn't afford. So, and that kind of project, I think, was one we're going to probably try and roll out. It's been in 3 boroughs so far, and it might go throughout London.
Brilliant, thank you. Mike.
Hey, Sean. Just to say, actually, it's worth reinforcing that the data shows actually we're the first generation that needs to make a proactive effort to be active, to build activity into our daily lives in terms of to be active enough for good health. So, you know, it's, you know, fully recognise the hierarchy of needs and the pressures that put on people. But I did some work with the last economic downturn with the Michael Marmot team, and we actually, it showed that from previous economic downturns, health behaviours get a lot worse, people get less active, their diet gets worse, etc. And also, you know, mental health and stress, etc., hugely increase. And you know, suicide increases, and all of these outcomes get a lot worse. So what we need to work with people to recognise actually the pressures that are on them. We can't lecture them. It never worked before, it won't work now. But we need to help them understand that actually, if they did get active, it would help their resilience during this challenging time, which isn't going to be a short one. It's you know, it's we know it's not going away tomorrow. So actually, we need to work with people to where they are and to help them build their resilience. So we know that being active can help them, you know, improve their mental health, deal with the stresses that they're dealing with, enable them to do what they need to do, whether it's work or other things, more effectively, and also, you know, whilst restrictions allow them actually that opportunity to connect with people. And we can see from the, you know, Sport England data that actually people living alone have their impact of they're being less likely to be active during COVID than those living with other people. So that exacerbates their likelihood of social isolation and poor mental health. So as I say, it's about recognizing where people are, but also letting them know actually what the benefits are to them in this context.
Brilliant, thank you. Sneha, could I bring you in? There was a comment on the chat earlier, I think, around childhood obesity and the kind of disproportionate impact of it, and the kind of systems approach to resolving those issues. And a few of us have spoken around Marmot and targeted universalism. So just interested in your reflection. So I think back, I guess, again, pre-COVID, but worth noting, I guess, the disproportionate poor impact that obesity drives through COVID, but pre-COVID obesity being one of the big public health challenges, and just your reflections on kind of targeted interventions and the approach that we should take there.
Yeah, okay, no problem. So in terms of childhood obesity, if I remember the stats correctly, I think it's when children start in reception, 1 in 5 of them are overweight and obese, and by the time they go to secondary school, it's 2/3 of them are overweight or obese. I think those are the stats. And so what that means is that, like, you have all this time when they're in school when you can do interventions. And the thing about obesity is that it's very difficult to, as an adult anyway, to lose weight. And people tend to gain weight slowly across their lifetime. And so I do think childhood is key for obesity in terms of trying to, you know, get those good habits down in terms of eating well and physical activity. It's a critical period.
Great, thank you. And Mike, I appreciate you're probably a bit of an expert in this area too, so I'll give you an opportunity if you wanted to offer any reflections there.
Yeah, I guess it's just really to agree. It's, you know, there is something wrong if children going to school is an obesogenic environment and time of their life. So we just have to think about actually how do we build the opportunities to be active across children's lives. And I think it was Tim who mentioned earlier about thinking both in school but also out of school. So we need to think about that offer across those areas. And it's not just about, you know, for middle class children whose families can afford to send them to football club or these different clubs. We need to ensure that everyone has equal access to that, because there's a huge socioeconomic gradient about childhood obesity, and we need to recognise that and put that at the forefront of the work that we're doing.
Brilliant, thank you. We're in our last few minutes, I think, so I'm going to ask the same question of all of the panelists to give you a chance. And the question is, what would you like the key messages? What key messages would you like delegates to take away from the session today? And I don't mind who goes first.
Okay.
Great, go. Sorry.
Okay. I think I'm going to try and do the dreaded thing of thinking up a rule of three whilst I haven't necessarily worked out which three they are. Because I certainly, number one is a very practical point, which is that the inequalities that we are seeing through the pandemic, if this session was, you know, about tackling inequalities, they were there before and they have been made worse. So it is not the pandemic that has caused the inequalities in activity levels and the benefits. We're all in different ways saying the same thing on this panel, which is that we recognize how holistically the benefit of being active can make such a positive impact on people's lives. So one message would be for us not to mistake the COVID pandemic as being the reason why these inequalities are there, but to recognise that they were there before. Secondly, therefore, that collectively we need to think differently about how to resolve this, and that we believe that that is much better served by working in collaboration at local level. And that is about not therefore devolving one scheme, you know, to every single town and city in the country, to acknowledge and respect the fact that for many people it is the circumstances of their lives that is preventing activity. To the combi model that Mike referenced, it is the opportunity as much as the behaviour and the competence that is there that we need to address. And it will be much better done if we think, therefore, about partnership and the way that people can work together to understand how resources, both locally and nationally, can be leveraged to that point. And thirdly, that this is a focus for Scotland, and I know that's relevant when it comes to people thinking about us as an organisation, our funding, our resources, and our role within government as an arm's length body. That we will see in our new emerging strategy the focus on this as being to use the words of Michael Marmot, proportionate, in that it will be disproportionately important to us over the coming period. That would be my three main points.
Brilliant, thank you. Who would like to go next?
I just have, you know, like a catchphrase. It's never too early, it's never too late, it's never too early to start in childhood, get children active and eating well. But likewise, once they're adults, it's not too late to try to intervene to get them on the right track again.
Brilliant, thank you, Snehal. And then Mike.
So I guess I had similarly three. One was, as I say, you know, recognizing the importance of physical activity for individuals and communities and across the breadth of outcomes, many of them which are even more important during COVID, such as social inclusion, etc., than before. As Tim said, you know, recognizing that actually these inequalities have been there and they've just been exacerbated, but also that actually we have been largely having success at reducing those gaps, so it can be done. And finally, you know, we have to keep remembering that COVID isn't a uniform experience across the population. It's impacting people in different ways, and so we need that insight knowledge, and we need to incorporate that in what we do, so we're providing opportunities that are accessible for all the population.
Brilliant, thank you, Mike. I'm going to attempt to follow the rule of three, which seems to have been popular today. But the first one is a very simple one. So there's been a couple of requests on the chat if we could share the slides, which I'm going to commit us to without knowing whether we can or not, but on the assumption that we can. We'll send those out. That's great, thank you. It looks like Tom Coffey has dropped off the chat. I don't know whether it's an IT issue or a GP surgery issue. I'll kind of conclude now. My second one of the three was around a huge thank you to the speakers and panelists. It's been a hugely informative and interesting session, and we are hugely grateful of your time. So on behalf of everyone and behalf of London Sport, a huge thank you to Tim, Tom, Snehal and Mike. And then my very final comment, and I think we are then bang on time, is just to promote and recommend people watching to, again, tune in for the sessions this afternoon, which follow on the three themes from this morning and equally for the rest of the 4 days. I know I'll be tuning in. It's incredibly interesting, so would recommend that people do that. So finally, I'll go back to my second one of my three. So thank you to the panelists, hugely appreciated, and I wish you all a good day.